Hello, good afternoon everyone, and I'm thankful for the opportunity given to me here, and on behalf of Fresenius Kabi, I'd like to thank everyone for their presence here and for giving us an opportunity to talk about our apheresis equipment. My topic for the afternoon is maximizing the efficiency of stem cell collection using complex cell separator. As we all know, hematopoietic stem cell transplantation is now an established therapy for various malignant and non-malignant conditions. And the conditions are getting redefined. So depending upon the result of both the transplant and the non-transplant processes, we have many therapies coming in the picture. So what are stem cells? Stem cells are basically cells which have an ability for self-renewal and reconstitution of the whole hematopoietic system. Stem cells are pluripotent. They are able to generate any cells of the hematopoietic system. They can be defined by the ability of extensive self-renewal and differentiation. They have the ability to reconstitute the marrow function after any irradiation or chemotherapy, and they lead to engraftment with reconstitution that is happening after transplant. So when we talk of distribution of stem cells, the stem cells basically are from the bone marrow, and where we collect them from the iliac crest, then from the peripheral blood. Peripheral blood is the one from where we collect the stem cell with the help of a procedure called leukapheresis, where we mobilize the stem cells and using hematopoietic growth factors and chemotherapy, and the cells are mobilized from the bone marrow into the peripheral blood, and from there we harvest them with the help of an apheresis equipment. And then of course cord blood, where we collect the stem cells from the umbilical cord after delivery. The main surface antigen is CD34 marker antigen, which is expressed on the hematopoietic stem cells. It's found in 0.5 to 4% of the mononuclear cells, and about only less than 0.3% of the mononuclear cells in the peripheral blood have CD34 positive cells. That is the reason why we need to increase the mobilization of the CD34 cells from the marrow into the peripheral blood. So, just highlighting the main advantages of the peripheral blood stem cell collection. It has a higher amount of CD34 cells. It has a faster reconstitution of the neutrophils and the platelets after transplantation. We have better immune reconstitution. And peripheral blood stem cell collection, the biggest advantage is that you collect it at an outpatient and OPD basis setting. You don't need any anesthesia, or there is no trauma which is there in a bone marrow aspiration. There is no risk of any surgery-related infections and other complications. It has a lower incidence of acute graft versus host disease. The only possible disadvantage of peripheral blood stem cell collection is the increased frequency and severity of the chronic graft versus host disease. And there could be some late side effects of giving the various growth factors. Now, they are not definitely seen in every patient, so we cannot exclude them completely. So what is stem cell collection or peripheral blood stem cell collection? Is a procedure involving the separation and collection of particular white cells from the peripheral blood. And the medical staff of any blood center or apheresis unit will set up the apheresis system as shown in the picture here to collect a certain type of white cell which is known as a mononuclear cell. So in short, there is a procedure of collection which involves the apheresis equipment, which is the collection of the stem cells with the help of this machine. Then there is cryopreservation of the collected stem cells. Then we have the chemotherapy given to the patient. At the same time, the product is removed out from the cryopreserved tank and it is thawed. Samples are taken for viability, and finally you reinfuse the stem cell product to the patient. So this is in short the steps of an MNC collection procedure. We'll just discuss about the various growth factors. The growth factors can be affected because of the mobilization technique, extent and type of prior chemotherapy or radiotherapy. If the patient has already received a lot of chemotherapy before, it can affect the mobilization. The patient donor age is also responsible for the mobilization. Then diagnosis and the presence of marrow disease. If the marrow is already infiltrated, it will affect the mobilization. The guidelines of ABB for doing apheresis to collect stem cells, the WBC count should be in the range of 1000 to 10,000 per microliter. The CD34 cell should be anywhere above 5 to 20 per microliter. Anyone less than 5 is considered a poor mobilizer. The platelet count of the person undergoing apheresis should at least be 50,000 so that he doesn't need platelets immediately. And the platelet count children should be more than 30,000. When we do an apheresis procedure for stem cell collection, we maximum go up to 4 times the total blood volume. The average usually is 2 to 3 times. Maximum 3 hours per procedure and maximum 5 procedures within 14 days. This is what is recommended by ABB. And what should be the yield of the product? When we talk of CD34 cells in autologous patient, it should be more than 2 into 10 to the power 6 per kilogram body weight. In allogenic, we need a higher dose because we are collecting cells from a different person. So that the risk of graft versus host disease remains. So we try to collect a bigger dose that's more than 4 into 10 to the power 6 per kg body weight. This is an example of the machines which can do apheresis. So we have the complex cell separator and the amicus separator which are able to perform stem cell collection successfully with high efficiency and low extra volume in pediatric patients. So how do we achieve the expectations with the complex? We'll just briefly discuss the various steps of complex collection. The main features of complex is an easy setup and removal of the chamber. So it's very easy kit installation. Then it has a KV or keep vein option and saline infusion capability. Anytime we can keep the vein option if there is any pause in the procedure. We can give saline to the donor or the patient to keep the lines patent. ACD drip monitor is controlled. Then there is a hemolysis detector in the plasma line which will detect for any hemolysis in the line. Centrifuge temperature sensor. The machine controls the temperature of the equipment because it's a very long procedure, about 4 to 5 hours. We need to maintain the temperature. The yield predictor for stem cell collection. This is a key feature of the complex cell separator. Is not seen in many other equipments. Is that the machine is able to predict the yield of the CD34 cells when you do a stem cell collection. And we can also export the data. We can connect it to the data management system and transmit all the data and save the data. So the main feature, as I said, is the yield prediction tool. So we put in the free CD34 count, and you can actually predict, plan and predict the post CD34 count. So you also put in the free 50 cells per microliter. We can say how much yield 10 to the power 6 you need. So this is how you can decide and predict, and the machine comes very close to the predicted yield. So it will tell you how many cycles you need to do, what is the volume per cycle, spillover, the Buffy code volume is how much. So all this is programmed to help you get a definite yield. The main feature of this yield predictor is to enhance the platelet collection efficiency, as operators and clinicians may not have to wait. So you don't have to wait for the laboratory results so that to confirm that the yield that we have set is collected or not. It helps to increase the efficiency and streamline patient care. It gives us the flexibility to adjust the number of cycles according to the desired yield. So once you know your count and the yield, we can control the number of cycles. And it helps us to decide whether we should continue the procedure the next day or discontinue if you have already connected enough. Then what you need for the complex procedure is known as an auto MNC or an automated MNC procedure. You need the P1YA kit. This is the chamber holder for the disposable and the machine. This is a picture of the disposable kit. It's you need ACD saline to be attached. These are the storage containers where the product will be collected. This is the chamber holder inside, where you have a holder coming in. It's separating into the RBCs and a PRP, and the Buffy coat remains here, which is then transmitted into the storage containers. This is the sedimentation, as I said, the red cells, the Buffy coat, and the PRP. So the machine normally moves at a 1500 RPM, but the RPM can also be adjusted depending upon the count. So CD34 is our target, and so the machine will keep on processing the number of cycles. It will tell you how much time it is taking. Accordingly, this bar will continue and will end once the timing is complete. So the machine tells you the approximate time and the yield. There are 4 phases in the procedure. Primarily collection phase, which then includes a small condensation phase, the spillover phase and the buffy coat phase. If we talk about the collection phase is the buffy coat is getting collected in the centrifuge chamber, and the PRP and the RBCs are returning. So this is how the procedure is going on. The whole blood enters inside. This is the whole blood. It is separated. The PRP is coming out, and the red cells are also coming out. So the buffy coat is getting concentrated inside the chamber. Then there is the MNC, the spillover phase in which the buffy coat cells are pumped by the plasma pump through the spillover sensor. So the buffy coat cells will start coming up and they will come towards the spillover sensor and the spillover clamp. Finally, the buffy coat cells, when we harvest, the buffy coat which has come from the spillover sensor and spillover clamp get collected into the product container. So this is the harvesting of the buffy coat by the plasma pump is pushing the buffy coat into the product bag. So this clamp opens up on the right hand side and it pushes the cells into the final storage container. What is important is the interface position. This is the empty position without the cells here. This is what you see the layers. The buffy coat layer is formed here. These are red cells and this is the PRP. This is what is seen in this portion. So if you observe, this is the control area where the interface is detected and it controls the position of the cells within the chamber. So this is the cells entering. Can you see the cells are coming here? So it's getting red and the cells are entering here at the beginning of the procedure. Then you have the buffy coat scheme formation during a collection phase. The buffy coat is forming. Then the buffy coat at the beginning of the spillover phase. So the buffy coat has started moving out. So that is the spillover phase. It's supposed to come out through the spillover line. This is how the buffy coat is moving ahead. It's getting here. Sometimes with the spillover, when too many RBCs can tumble in, so we need to control the spillover to prevent the red cell contamination. So what's important is the spillover management. The whole process is automated. We can allow the whole procedure to continue automated. However, sometimes to prevent red cell contamination and platelet contamination, we can use the spillover management, which is an effective tool for expert operators to prevent even more contamination of unwanted cells. So we can actually have a look at this buffy coat coming out through the spillover line, crossing the spillover clamp and the sensor, and then you realize that you can actually use this stop phase to stop the unwanted cells going into the storage container. And then at that time you can set in how much volume of buffy coat you need to move into the product and not allow the red cells or platelets to get contaminated. So this is the spillover, which is controlled by the spillover detector and the spillover clamp. So it controls how much cells should go inside for collection or whether they should be made to return back to the donor. So this is in short a study which talks about the performance of the stem cell collection, which was published way back in 2005 at the Bavarian Stem Cell Center. It talks about the actual this is the, if you see the yellow portion is the CD34 count of the donor per microliter. Then this was what we requested, how many cells we want and how much we have actually collected. We have the very high collection efficiency has been achieved. So if you see, we have achieved a very high collection efficiency in many places, more than 100%. So the machine is able to accurately predict how many number of cells you want depending upon the pre-CD34 count. This was a study which was conducted in Italy, which studied the automated MNC protocol, and it demonstrated very high CD34 collection efficiency, and moreover the ability to predict the CD34 cell yielded improved management of the leukapheresis collection. And this was a study published. There are various studies in Australia which were conducted on Comtech because they are using Comtech as one of the key equipments for collecting stem cells and other therapeutic procedures in Australia. And it was a study which was comparing the Baxter CS3000 Plus, which was considered initially the machine for stem cell collection, and comparing the Comtech. And study was done with data from 79 consecutive collection procedures for compared, and it actually said that the Comptech cell separator showed better collection efficiency. Median was 65.7%, in the Baxter CS result, which was about 54.6%. So it showed a very high collection efficiency, and it also showed that the actual collected yield showed a significant correlation between the yield prediction values. So another important feature of the Comptech was the yield predictor. So high collection efficiency and sticking to a good indication of the collection yield and the prediction yield. So that was equally important. So this led to the center's shift from the CS3000 to the Comptech cell separator. So if you summarize the key features of Comptech stem cell collection, it has a high efficiency of CD34 cells, which range from 7 to 126%, as we saw in the Bavarian center data, where the collection efficiency has gone above 100%. The yield prediction is based on the patient's pre-CD34 values. The automated procedure for predicting the volume, so the machine will automatically predict how much will be the volume per cycle, the spillover volume and the buffet volume. But at the same time, it gives you the flexibility to change the parameters. It will tell you the prediction of separation time. The machine will tell you how much the procedure time will take. You can also collect any autologous plasma. Suppose you want to do cryopreservation using plasma, so you can collect plasma simultaneously in the procedure. And especially in pediatric patients, we can actually go at a very low flow rate of 10 to 15 ml per minute, which is of course very slow. But in pediatric patients with low extracorporeal volume and low body weights, less than 20 kgs, we can use the low flow rates, and the machine also has a provision to do blood prime, so that the pediatric extracorporeal volume is maintained. So this is in short the main features of the Comptech cell separator, and how with the help of the spillover management we can maximize the efficiency of the machine. Thank you very much. Any questions? Okay.